Migraine is the most common type of primary headache problem that people experience, and somewhere between 30 and 40 million Americans experience migraine. And of those who are being diagnosed, many people have headaches so frequently that they should have treatment designed to try to prevent their headaches, but either they're not recognized as having headaches frequently enough to do so, or, and this is very tragic until recently, the preventative medicines are either ineffective or poorly tolerable. And then people don't renew their medicines. They throw their hands up and say, I don't want to take this treatment. Among the current FDA-approved preventative medicines for migraine include a medicine that can cause liver toxicity, weight gain, hair loss, and tremor. Another one that can cause glaucoma, kidney stones, cognitive impairment. Another one that can cause blood pressure changes. And sure, these were steps that helped us go forward in the past. We have another one that's very effective for chronic migraine, a specific subset or a specific diagnosis where 15 or more headache may be experienced a month, 8 of which are migraine more than 4 hours per day for more than 3 months. And that's an injectable treatment. And that has certain benefits as well. Over the last couple of decades, the idea that there are various neurotransmitters that are specifically involved in pain and sensory processing in general has emerged, and there are many, many different neurotransmitters that are important. And as this story has evolved, several neurotransmitters have become very important in pain transmission in general. So substance P, glutamate, for example, neurokinins, and CGRP. So CGRP stands for calcitonin gene-related peptide. We express CGRP throughout our entire body. However, the more relevant aspect of this is that all the relevant brain areas that are involved in the migraine experience involve CGRP release. And we know that CGRP can sensitize, can make the nervous system, both peripherally and centrally, more sensitized. And what a person experiences during a migraine, just loosely speaking, is a very sensitized brain. And so over the last more than decade, with this knowledge about CGRP, efforts have been underway to develop very targeted treatments to either block the CGRP molecule itself or to block the receptor, the dock, that it has to bind to. And that incredible work done by just incredible people has led to the current availability of one FDA-approved treatment, which is a monoclonal, very specific antibody targeted to the CGRP receptor. Many studies have shown that during a migraine, CGRP levels go up in the blood and other portions of the nervous system, and they fall when either effectively treated with, let's say, a triptan to abort the headache or when the headache's over. And now, if CGRP is being released during a migraine and you have the receptor blocked, the molecule can't go anywhere, theoretically. I know I'm anthropomorphizing a little bit, but that's the point, okay? The other 3 medicines that are being developed and have not yet been FDA approved are actually those that block the actual molecule. And so collectively, the data that's been out there, it's been very consistently robust. Amazing benefit for a significant number of people with with side effects which are very, very tolerable and very different. But the availability of one and theoretically soon more additional monoclonal CGRP monoclonal antibodies is just the first time that a treatment has been developed for migraine, specifically based upon science that was completed, that demonstrated the role of this molecule in migraine and blocking its effect. if there was ever a time to view migraine as a medical condition with a much more clear understanding of its pathophysiology and of the really tremendous ability to intervene successfully to alleviate a person's suffering, it's now. And I think I can only hope that, much in the same way that a provider would never say, oh, we're going to ignore your hyperglycemia. We're just not going to pay attention to your blood sugar of 200. We're going to ignore your LDL of 350. We're just, those inverted T waves on your EKG, we're just going to ignore that. Perhaps this will, for a variety of reasons, elevate migraine to being recognized as a chronic disorder, a chronic disease. It's one of the most common disabling disorders in the world in terms of years lost disability. And so this will hopefully really elevate migraine to a point where it's proactively diagnosed, and providers feel empowered not only to diagnose but to treat.